Have you ever struggled to find a specific medication even after looking everywhere for it? Let me tell you that you're not alone. We've all been through this process of being incapable of controlling the critical situation we're in. We're happy to announce that through the chance we've been given in the Challenge of Junction competition, we were able to work on an application that deals with this kind of situation. Morbone's application for patient needs, healthX. Let's imagine a scenario. Grandfather Ahmed arrives at Hospital X. He takes tickets to reserve a place for an appointment with a doctor. At the exit, he asks the nurse the nearest pharmacy to buy his medicine. She replies that the closest is in front of the hospital, but which is often in lack of stock of certain medicine. She therefore suggests using Morbone's application for patient needs to find the nearest pharmacies which contain all the medication mentioned in the prescription.
We have four main pages. Reservation. You can use this page to choose a department and have your own ID to reserve a place. Hospitals. This option allows you to search about the nearest hospitals according to the availability of beds, machine, and number of places, and also having the road to the chosen one, and even have that road on your own phone after the scanning that QR code. Pharmacies. After the consultation, you can write the first ID here to check the prescription issued by the doctor and search for pharmacies that have those medications. Emergency. This option allows you to reserve place and have a higher priority in the waiting line.
This is the backend side of our application. We have created a structure that helps us communicate with the front end easily. This program simulates the check-in of patients for normal services and for emergency cases. The check-in waiting lists are unique for every service, like it is shown here. For the emergency cases, if the length of the waiting list gets above a certain threshold, our app will propose other nearby hospitals that has less people waiting in line. For the pharmacy route feature, our system detects the ordinance that is linked with the patient ID and then uses the function getRoute that will use a score system to know which pharmacy to add to the route. Our system will also inform the patient if it didn't find a certain medication in any of the registered pharmacies, like it is shown below.
Who does our app serve? Our product will be very attractive to both government and private medical sectors, as it will improve the quality of service for the customers, which is very important when dealing with hospital patients. It will do so by removing the frustration of having to wait in line for an unknown period of time, automatically process the list of medicaments the doctor prescribed, and find the closest pharmacy that contains them all. In case of an emergency patient, if the queue is already full, it will propose nearby hospitals with available room. So any health institution searching to increase service quality or attract more customers will be interested in our product. We project a slow but steady start with around a dozen of customers for the first year, but that in 5 years our product will be widely adopted with around 500 public and private clinics using it. And here's our complete business plan model.